As we've been reporting, there's real concern about the growing prevalence of AI and other technologies in higher education. But some schools have found benefits as well. In the case of nursing programs, more and more are integrating immersive technologies like generative AI and virtual reality into their curricula. Rogin spotlights one of those for our series, Rethinking College.
It's a familiar hospital scene. The patient's heart has stopped. It's a code blue emergency. But this patient is a mannequin. And while this looks and sounds like a hospital, it's an immersive, interactive lab.
It really mirrors just what they would see in any given day in the hospital.
Tina Scott is director of the Experiential Learning Center at North Carolina Central University.
There are scenarios, case studies that we can embed and just transform that room into any type of scenario we would want it to be.
You hear beeping, you may hear someone screaming. They can even simulate smells.
North Carolina has one of the largest projected nursing shortages in the country. To help meet demand, schools like North Carolina Central University, a historically Black institution, are turning to technology.
We're able to train more students. We're able to bring more students in any event that we cannot get a clinical space. We can do a clinical day right here.
NCCU does not have a hospital, which means students have faced barriers to securing clinical placements where they would get hands-on experience in a real-world healthcare setting.
We're competing against a lot of other nursing schools for clinical rotations.
So immersive technology is expanding access for students like Jasmine Locklear, a member of the Lumbee tribe of North Carolina.
I grew up in a real small southern rural area. Access to healthcare isn't always the best. I wanted to be the change for our people that we needed to create.
NCCU introduced virtual reality clinicals 2 years ago.
Hello, my name is Haley. I'll be the nurse working with you today.
Students are put in virtual healthcare settings where they treat patients that are powered by conversational artificial intelligence.
Can you state your name and date of birth for me?
My name is Habib Abdallah. I was born on July 13th, 1949.
He's very sensitive, so very realistic, and they go in and take care of the patient.
Mr. Habib, are you in any pain?
I have a headache rated around 4 out of 10, but I don't want any pain medication.
First-year nursing student Haley Turner thinks this kind of practice is invaluable.
The biggest things that I'm, still get a little nervous about is actually talking to the patient, like knowing what to say, knowing the right questions to ask them.
Clemson University researcher Jason Thrift says exam room nerves are common.
Simply knocking on the door and walking in the first time and being able to just talk to a patient. That can be the most scary and trying thing that they do when they're first trying to understand these processes. So putting them in VR, that can kind of take away some of that angst.
Jasmine Locklear had a miscommunication with one of her AI patients.
I do have an accent sometimes, and I needed to enunciate better so that I didn't offend the patient, because she kept telling me that I was pronouncing her name wrong. And that's a very real scenario that I could experience in the hospital.
Scott says VR clinicals sharpen several skills.
Critical thinking. That patient is vital signs are changing. What am I going to do? Not only that, but delegation. Now that I'm in this room taking care of this patient, all of a sudden I'm getting a buzz from my other patient in the other room. What do I do? Prioritization. Which patient should I go see first?
Kimberly Johnson is in the accelerated nursing program.
I had 4 patients that were that could have all been deemed high priority.
Walk me through that decision-making process. How did you prioritize those 4 patients?
So we have something called pre-brief. It allows you to see the client's vital signs. It allows you to see their diagnosis. It allows you to see medications. And it also allows you to see what was done before you entered that VR clinical. And so I often would just use that as my guide to say, hey, if this was already done for this client, I know that I can lower this client's priority status.
Afterwards, students debrief with their instructors.
We're able to talk to them about their behaviors, what went well. It actually will give them a report. So they're actually able to see their gaps, those things they may need to work a little bit more on. It also helps us tailor a better plan for them.
And, says Professor Janice Collins McNeil, since these are simulations, there are no life and death mistakes.
The students are here in a safe environment where it's okay for them to make their errors because that's a teachable moment.
But there are drawbacks to headset training.
The VR in particular isn't great if you have motion sickness.
But Locklear says illness isn't an issue in the immersive interactive room, where students can experience more than 2,000 medical training scenarios with images and graphics projected onto the walls. Johnson raced the clock to spot all the hazards in a hospital room.
Sharp spin overflowing.
When I'm walking into rooms at a hospital during clinical, these are the things that I need to be looking for.
The technology is used to test knowledge through interactive games like Jeopardy!
A client is experiencing a nosebleed. What terminology would the nurse use when documenting this? It is epistasis.
After the introduction of immersive technologies, North Carolina Central's pass rate for the nursing licensure exam rose from 94 to 96%. Professor Collins McNeil thinks her students are more prepared than ever.
We're seeing a level of professionalism that we had not seen this early in their education. They're much more critical in their assessments and their decision making.
I think that we will see VR become kind of a mainstay for a while.
As nursing programs grow to meet high demand, Clemson's Jason Thrift predicts the use of virtual reality will grow too.
It may provide an ability to do more clinical aspects, even including when they become a nurse, to help renew training for, say, CPR.
Jasmine Locklear, for one, is eager to put her high-tech training to good use in the real world.
There's something at home that we like to say about making an impact that lasts the next 7 generations. As a nurse and a future family nurse practitioner, I want to make sure that we're living our healthiest life and we're not still dealing with the health disparities that plague our communities.
America's nursing shortage is critical, but on this campus, America's nurses-to-be are showing strong signs. For the PBS News Hour, I'm Allie Rogin in Durham, North Carolina.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.